All right, guys, so for the double lift, you definitely need to choose your points carefully. We're gonna come into the center, and that's what you wanna make sure you do. Come into the center, and you wanna create a bleb. And I put a little bit more generous here. Okay, kind of your exit points, you kind of want to bleb as well. Okay, cool. We've done that. Now I'm actually going to take a cannula. Grab a cannula. And I'm taking a 16 gauge needle. And we're going to create the port site right where he's starting to blanch out. You feel that?
Yeah.
Okay. So I want to create enough of a hole that we allow for the tissue to not pucker so much into this area. So remember, what we're trying to do is the two needle points are going to come in from this angle or from this single entry point and go into the other directions. So since we're doing that, I'm going to create two entry points, and we're going to slide our cannula. And this is just for numbing. I'm going to slide it down through his tissue. All the way down. I'm going to just put about 0.1 take the same thing and we're going to slide it down the other way. Perfect. I'm going to do the same with the second point. Slide the cannula all the way down and place product or lidocaine all through that whole area. Same thing on the other side. All the way down to the end. Perfect. Beautiful. So once that's done, remember, let it sit for 5-10 minutes before we go back in. In the meantime, let's talk about this double lift. So this is the double lift from Viola. This is double lift from Viola. It's 110 millimeters. And so what it is it's a blunt tip needle. So it's kind of like a knitting needle. If you guys do knitting, I know it's hard to imagine, but if you can kind of see, this is the needle and the thread. And so it goes in from one direction, and we're going to come in from this direction, and we're going to go to the one opposite side. the other needle is going in from the same hole, and it's going to go to the opposite side. The unique thing about this is that it is bidirectional, but if you think about it, it's like two threads. If you cut it in half where there is a little transition point on the thread, if you cut it in half, they're two unidirectional threads placed together. So it's kind of, you can say, bidirectional in the whole thread itself. So what we're going to do is we're going to get lifting all on one side, and we're going to get lifting all on the other side. And so it's going to really tighten and pull him in, almost like a necklace, kind of hold his double chin up in that area. Okay, and that's our goal. We're going to start from one single site in the middle. Other way you can do it that I have done is where you come into the fascial layer on this SCM, this sternocleidomastoid fascial layer, and you start the point from here, and then you exit here and here. So essentially you get the same thread coming with this point essentially going like this, and then the other thread going like this. So the anchor point is going to be here with the two exits in the middle. So you can do it that way. I prefer this way, where we start from the middle and wrap one thread from one side to the other. I think it holds a little bit better in that sense. But there's no right or wrong way, just whatever you're comfortable with. Alrighty. So I'm gonna leave that there. How you doing?
Good.
So here we go. Found my entry point. And we are going to slowly thread the tissue. And what I'm doing is every so often just making sure that I'm in the subcutaneous tissue layer as I go through this whole tissue layer. Okay. If you feel as though you are not in the layer that you want, back up with it and readjust your angle. Okay, pretty much to my exit point here. And so what I'm gonna do is I'm gonna punch through the tissue. As you can see, punching through the tissue. And I'm gonna push on the needle, and we're going to pull the needle through. Make sure that you only pull it through just part of the way and not all the way, otherwise you're going to miss the central point that this is. So just leave this on the side, and then we're going to grab the other side. And we're going to come back, and this is probably the hardest part, is to go back through the same entry point. And you're going to come in, and we're going to find the correct level that you want, subcutaneous tissue layer, and keep slowly threading it. And we're just slowly advancing it as we're going through subcutaneous tissue. Make sure you're in the right plane, the right level. Check every so often. Here we go. We're all the way almost to where we want to be. I have the blanching site right there. So we are going to pretty much start an exit point right here. And if you have trouble with your exit point and getting it, one little trick that I do so you don't poke yourself is I take the end of the scissors and I have it pop through using the scissors. Okay? And then you can pull this through. Okay, so you kind of see where we have this pop through, and we didn't pucker the tissue because we went through the same hole. You kind of feel how we can pull really, really tightly into this area. And so we'll just mold him. And what I typically do is I'll cut the thread slightly, or I'll cut the needles off before I cut the threads all off. And I'll put that aside, and then we'll work on the other lift first before we completely cut all the thread. Okay. Oh, thank you very much. So yeah, this is one where if you wanted to do more of a sterile technique, you could definitely consider it. You can wear some sterile gloves. You are touching the needle that is going through the tissue. I try not to touch the thread when I'm doing this one. But if you want to do sterile technique, then it's okay, because then you can touch the tissue, you can prep the area, make it a little bit more sterile. But as long as you can make sure that you're a little bit more, have clean technique, you're probably good as well. But just make sure that you try not to touch the thread so much if you are doing this technique. So you can kind of see, I want to go right here. I'm going to push through the tissue, get it through. So I'm going to use my, there we go, perfect. That tip actually helps to get, back of the scissors helps to get your tip through. And you just pull the tissue until you have a little bit of that thread out. Sometimes if you're afraid you're gonna pull too much or the needle's gonna do it, cut the needle first before doing the other one. The hardest part is always finding the same entry point. There we go. I'm going to slowly traverse the tissue in the subcutaneous area. Feels good to me. He's a little numb in this area, so I'm going to pop this out. We're going to pull just enough. Sometimes I hold the other end just in case. And kind of give it a nice balance. There we go. That popped in nicely. It didn't pucker too much, so that's good. Beautiful. So now we're going to cut the thread, or we're going to cut that needle off, and then we're just going to mold this area. And so I kind of give this a little pull. Pull this side. How do you feel?
Good.
You feel this?
This is tugging.
This is tugging, good. All right, so now last thing we do, clip the ends so they don't poke into his hypodermis. So make sure you go in deep enough. Beautiful. So we'll just pop the thread underneath the tissue. Pop the thread underneath the tissue. And if you do pucker the tissue up into this area, you can take your 18 gauge needle and kind of loosen up some of the tissue. So if you feel as though you need to open it up like this one, a tiny little bit of pucker. So I'll kind of just dig a little bit into this area just to release the tissue just a little bit. And that's all you need to do. Because sometimes it pulls down on that skin. You caught into two different whole areas. And so it just, but they have a slight pucker. It's okay. That will soften out over time. All right, guys, let's see. Sometimes this does a great job of building a foundation, and then what I'll do is I'll come back in still and add a little bit more, but I'm gonna have him sit up for us. And let's check him out and see how that helped him out. Let's go ahead and have a see. Wow, see that? That did a beautiful job. If you take a look, go ahead and turn for us this way and stick your head up. You can kind of see that actually really and actually pulled his jawline up really nicely. What I'm gonna do is I'm actually gonna do his jawline first, see how that is, and then if I feel as though I want to pick it up a little bit more, I could come back in with a little bit more of the cog, the barb, like an 18 or 19 gauge, and do a little bit more into that area. How was that overall?
Good.
Not bad?
Not bad.
All right, go ahead and lay back down. Let's do your jawline a little. Okay, let's start off from this side. It's a little numb here, so I'm gonna start off with the little. And so I like to start my portholes straight on perpendicular into the skin, just until you feel that pop right into the subcutaneous tissue layer. Typically it's right where the bevel ends, the bevel tip ends, and it does a beautiful job right in that area. So we are going to take, let's see, we're gonna take this one. I believe this is our 19 or 18 gauge. So we're gonna give, he has a little heavier tissue, which is great for this one. Turn for us this way. I like to guide, so I like to pinch the tissue, hold strongly, so I can feel where the tissue, where my thread is guided. And we're just gonna continue sliding it up to right about where the DAO would start. And then I kind of grab tissue and pull it over the tip. Beautiful. That's done a nice job. Do the same thing with this one. We're gonna grab tissue in this area. My preference is always to typically do one side first and then let the patient kind of see what the results are so that they see from side to side. It's always nicer to me to do it that way because then the patient sees the results of what's going on. So you can kind of see we're pulling him tightly through this area. Remember, make sure, because these are pre-loaded cannulas, and I should show you on one of them, they are pre-loaded. I'll show you in up close. These are pre-loaded. And so because they're pre-loaded, once you push in past this plastic portion that pushes it off, you almost are starting to get very committed to the tissue. Once you're in the tissue and the barbs start to connect in, you can't move the tissue and go back and forth and change your mind and stuff like that. You need to be very dedicated and confident in the tissue plane and what direction you're going. So make sure you understand, plan it out, make sure that you really, really get through your tissue properly and are not moving it all back around. You can't go up, forward, and then back, down, and change the direction, because your thread will clip in and then you're gonna feel it start to slide in without the proper placement of your thread. Okay, so just understand that you definitely need to understand that. There are threads that the Viola has that have that are not already have the plastic, and they're not what we call pre-cannulated. They're called plug type. They have the thread in there, but they allow you to be a little bit more functional, and you can go back and forth on it. Yeah, and then make sure that when you do place the thread, once you're ready to release the thread into the tissue and pull the cannula out, hold it on the tip and then slowly come out and slowly follow the tip out so that your thread stays in the place that you want it to be. So right now we're going to go ahead and tie him off slightly into this area. Right, beautiful and easy. Pop, pop, pop. I see a little puckering, sorry. Beautiful. Good. Has done a nice job lifting this side of the tissue. Let's do the other side just so that we're done with the thicker barb threads. All right. I'm going to try to fold it a little bit. Beautiful. We're going along this tissue plane, staying in that subcutaneous tissue layer. And you can see I'm not going back and forth. It may look like it, but I'm really kind of just holding the tissue steady. And I'm holding the tip and making sure as it's coming out, I'm following it all the way out. Okay. And then here's the last one for this side. I'm going through tissue right here. You can see how much pull this 18 gauge has on the tissue, which is what we're looking for. And we're going to tie this off. Remember, don't start tying it off until you're really, really good at it. In the beginning, just pull on the thread and then and just cut them, because then you'll get a feel for the tissue layer. As you get better, understand what you can do with your threads and how much pull you can give them, then you can start to do a little bit more tying. But if you feel confident, you can start tying it. My thing is that tying it does require a little bit more finesse and understanding of it so that you can really, really get it to pop in place nicely, as we did here. Let's see.